Hi everyone, I'm Dr. Keith Unger. Welcome to our Ultimate Thyroid Health video series. By now, hopefully if you watched video number 1, we gave you an overview of the thyroid series. The rest of these series of videos is to educate you about different aspects of the thyroid gland, thyroid pathways, nutrients and hormones that affect the thyroid so you can have a complete understanding. Now, video 1, I touched on the autoimmune condition known as Hashimoto's thyroiditis. 90% of people who have hypothyroid conditions in the United States have Hashimoto's. Because this is such an important topic, I devoted this entire video to this topic. I'm also author of the book, Your Thyroid Chemistry Doesn't Lie. You can find it on our website at www.balanceyourchemistry.com. Now, before we get started, I would like to tell you a story again on how I got into practice of functional medicine and specifically treating autoimmune conditions like Hashimoto's. And autoimmune conditions are near and dear to my heart since I have an autoimmune condition myself, as do several of my family members. At one point, my body was covered with about 90% psoriasis. I wore long sleeve shirts and pants. This is how I dressed when I went to a pool party. I tried the medical route for my psoriasis. They gave me creams and gels. They gave me injections, and it just kept getting worse and worse and spreading every time. The more I used the creams, the more it seemed to spread. And at one point, I told the doctor, hey, we have to get more aggressive. And the doctor recommended that he could prescribe me a medication. So I wisely asked him, what are the side effects? He told me that if I got a common cold, it may kill me because it suppressed my immune system so bad. This drug would suppress it so bad that I could die. And I asked him if there was any other side effects, and he said it could also cause lymphoma or cancer. It was at this point I decided that there had to be a better way. So I decided to figure out how to treat my condition. And if I knew if I could figure it out, then not only could I help myself, but I also could help family members and my clients. One of my sisters has Hashimoto's. I saw her suffer for years until I learned how to help her. Hashimoto is an autoimmune disorder. It's not a thyroid disorder. Okay, and an autoimmune disorder is when the immune system becomes disorganized and confused and it ramps up, and what it does is it attacks the thyroid gland. In this case, the thyroid gland. It can attack other tissues. Okay? So Hashimoto is not an immune disorder, it's a thyroid disorder. And 9 out of 10 people that have hypothyroid in the United States is caused by Hashimoto's thyroiditis. Okay, so that means your immune system is attacking your thyroid. Now, a lot of times hypothyroidism is mismanaged. Now, I'm not saying this to bad rap any doctors, but it is a fact. And this is why. Typically, clients go to their doctor, they have a TSH test run. That stands for thyroid stimulating hormone. It comes back elevated, and the doctor prescribes Synthroid, levothyroxine, or Levoxyl. Then they ask you to come back in 8 to 12 weeks so they can rerun your blood work. They rerun your blood work, and then they tell you your TSH is normal and your thyroid is fixed. But you say, wait a minute, I still have all my symptoms. I still have hair loss, weight gain, depression, constipation, sleep problems, fatigue, brain fog, thinning of the outer third of the eyebrows. I hear this story every day. And clients are taking thyroid meds and they still have their symptoms. Why? Because it's most likely because you don't have a thyroid disorder. You have an autoimmune disorder. It's your immune system attacking your thyroid. So you must address the underlying problem. In this case, this would be you have to address the immune system. Why is it ramped up, disorganized, and over-confused? Now, sometimes you may need to stay on your thyroid replacement hormones. If you look in video 1, I told you that the TSH only measures 3 out of 10 metabolic steps. And if those 3 steps aren't working, you may have to stay on that. And sometimes people with autoimmune conditions, they have to stay on thyroid replacement hormones because too much of the thyroid tissue has already been destroyed. Now, it often happens that a person with Hashimoto's gets their TSH levels into a normal range with their thyroid meds, yet their symptoms are still present. Or maybe they're getting worse. The inability to lose weight, difficulty falling asleep or staying asleep, constipation, you walk by a salad bar, you gain 4 pounds and you didn't even stop. So you have to ask yourself this question. Why am I still having my symptoms when I'm taking my medications and all my blood tests are normal? The reason is you still have all these symptoms because you do not have a thyroid problem. It's an autoimmune problem. Your thyroid gland is secondary. Some of the symptoms, as I'll repeat, fatigue, being cold, mental fogginess, brain fog, thinning of the hair, cold hands and feet. I mean, did you ever walk into a room and wonder what the heck you were doing in there? Or you have difficulty focusing on a certain task? Now there's other symptoms such as constipation, the weight gain, anxiety, depression, the list goes on and on and on. And a lot of these can overlap. It could be blood sugar problems. So we need to figure out what's causing your symptoms. But we're specifically talking about thyroid and Hashimoto's today, so we're going to stick with that. So, if your TSH levels are normal and you still have the symptoms, then basically the patients are typically treated by a myriad of drugs by their doctor to help alleviate their symptoms. You say, Doc, I just don't feel like my old self. Well, the doctor thinks you're depressed, and then they want to give you a prescription for an antidepressant medication. Or if you say, Doc, I have trouble falling or staying asleep, or I go to bed and I wake up 2 hours later and I can't get back to sleep. What's your doctor do? He's going to give you a prescription for a sleeping pill. It's crazy. They're not getting to the underlying problem. So why not ask the right question? What is causing your symptoms in the first place? If we can determine the underlying causes, then we can fix the problem and not just try to medicate the symptoms as they do in conventional medicine. And not against that, but sometimes we need to address things from a different standpoint. So to understand Hashimoto's and to prevent further autoimmune disease, you must have a basic knowledge on how the immune system works. Now I'm trying to make this simple and break it down for you. First of all, there are two parts to your immune system, Th1 and Th2, and they need to be in balance. So let me just flip this around here and just show you what I'm talking about. As you can see, you have Th1 here and Th2, and they need to be in balance. Now, what happens is that if your Th1 side is more dominant, then your Th2 side is going to be less dominant. If your Th1 side is less dominant, then the Th2 is going to be more dominant. So, first of all, we have to figure out what dominant side you are. Are you Th1 or Th2? I can tell you most people are Th2 dominant. So, as I told you, you have an autoimmune disorder, okay? You have to find out if you're Th1 or Th2 dominance so we know what to balance the immune system. So it's kind of like a teeter-totter, okay? And we have to determine what side is high and what side is low. And we have to realize we have to balance this out. Now, on the other hand, if you are Th2 dominant, then you need to do things that will boost your Th1 side. So if your Th2 is up, we need to bump up the Th1 side to make it more balanced. If Th1 is high, then we need to bump up the Th2 side. Bump this up to bring it back into balance, okay? So, the Th1 system, let's talk about it. There's two sides to your immune system. We have the Th1 system. This is like the Pac-Man of the body. We call these T lymphocytes. And basically, these Pac-Man move around and gobble things up. The Th2 system is part of the immune system that goes around. They put labels on things, and they basically tell the immune system, these are the things we want the Pac-Man to gobble up. These are called B lymphocytes. And there's certain inflammatory cytokines, and they're labeled, and there's different numbers. And actually, these can actually be tested for them. So, basically, I tell people it's kind of like when they're going out to cut trees down for a logging company. They go out and they put a ribbon around them so the workers knows which ones to cut. Well, the immune system labels or tags the bad guys, and the Pac-Man comes and eats them. Now, there are over 80 serious and chronic illnesses involving almost every organ system of the body that are autoimmune diseases. With thyroid patients, what I see in my practice is the vast majority of thyroid issues are autoimmune, such as Hashimoto. Now let's talk about some other autoimmune diseases. You've probably heard of some more common ones, multiple sclerosis. That's when the immune system attacks the sheath of your nerve root. If my arm was the nerve and you have a sheath over it, the immune system attacks the sheath, so it would be attacking my shirt, and it breaks that down. We also have lupus. We have rheumatoid arthritis. Type 1 diabetes can be an autoimmune disease. And of course, psoriasis, what I had, was an autoimmune disease. And these things can affect the nervous system, your GI tract, your endocrine system. It can affect your eyes, such as Sjogren's syndrome. It can affect your joints, such as rheumatoid arthritis. So, in all autoimmune disease, the body's immune system has become disorganized and confused, and it attacks the body's own tissues and organs. Now, our immune system was never designed to attack our own healthy tissues. There's a test we can order from Cyrex Lab that will actually tell what part of your body your immune system is attacking. This is an incredible test because most people won't know about their autoimmune condition until it's full blown or until the tissue is most totally already destroyed. Wouldn't you want to know in advance if you're a candidate for getting an autoimmune condition and getting your immune system balanced before it does severe damage? And remember, it is genetic, so it runs in families. So why not test for it and catch it early? It should also be noted that 50% of people who have one autoimmune condition will have more than one. We call this polyautoimmune. Wouldn't you like to know if these conditions are already brewing and do something about it before the tissues get destroyed? Now, the reason the immune system becomes disorganized is because something broke through the body's immune barriers. Leaks can develop in the gut's lining called leaky gut syndrome. and it can also happen in the brain. Okay, this happens due to stress, unhealthy gut environment, unhealthy diet, unhealthy lifestyle, food sensitivities can also cause it, and so this can affect all of these. So what do I mean by that? Well, we have to realize most of us are eating the standard American diet. I call it the SAD diet, for Standard American Diet. Okay? They're not exercising, they're drinking diet pop like it's going out of style, they're eating fast foods, they're eating all kind of foods that they may be sensitive to and have no idea that they're sensitive to that. So, you have to realize, you have to make some changes. And I don't accept everybody into my practice. I'm very, very choosy who I accept in my practice as a client. Why? Because I want to make sure I get those people better. And if the client or you are not willing to change or get rid of your bad habits, then that's telling me that you're not serious about your health. And you won't get in my program. So, I told you how the immune system works about Th1 and Th2 in the introductory lecture, and I just explained that a few minutes earlier. So let's talk about how the immune system is stimulated, okay? First of all, let's say you have a dirty knife and you cut your skin. There's macrophages in there. And what they do is those macrophages, they go around and start eating up that bacteria, okay? Now, there are some things when you start to get leaky gut syndrome, and I'll explain how that works in a minute, and basically these bacteria or undigested food particles or parasites or mold or environmental toxins, they get into the body and it actually attacks them, okay? So, remember, Th1 and Th2, it's kind of like a teeter-totter. And basically what they do is they create this thing called an antigen presenting cell. And this draws the T helper cells, and that's part of your Th1 immune system, okay? And then what happens then is that the humoral immune system is the Th immune system. This is the one that actually tags them. These are B-cell antibodies, and then they're produced to identify the intruder for future reference. So once you make antibodies, if that intruder comes back into your system again, it's going to go there and attack them much more rapidly. So basically, these are the guys that put name tags on them, so what the immune system knows what actual things to destroy. Now, what happens is they mistag some of your healthy tissues, and then your body starts destroying your own healthy tissues. So, for instance, if the body isn't making enough T suppressor cells, the immune system attack can go on and on and on, because those T suppressor cells are supposed to calm things down. This is why people can have chronic conditions that they've had for years, 20, 30, 40 years, okay? And remember, the same thing can happen if the body makes it too much interleukin-2. Okay, that can ramp things up on that side. And basically you get an overabundance of natural killer cells, and you get cytotoxic C cells, and this puts healthy tissue at risk. So if you are Th1 dominant, what are you going to have? Too much interleukin-2 or interferon or tumor necrosis factor. You're going to have too much of those. Now, you also have to realize that if you're going to have Th2 dominant, we're going to see more of these cytokines, okay? And cytokines is just a fancy word for cells that come from the immune system. Now, a high carbohydrate diet can cause insulin surges, resulting in overproduction of the B cells. And you get lots of sugar, lots of carbs, some of you are eating tons of gluten and you don't know you're sensitive to it, and this is not good for the Th2 dominant person. So there are certain things that can stimulate these different types of, the different sides of each immune response. So, now let me tell you something. A lot of people I test, they have food sensitivities. They can be sensitive to gluten, dairy, soy, eggs, chicken, rice, corn, potatoes, other grains, coffee, you name it. And when you eat these foods you're sensitive to, it causes inflammation in your gut. And remember, up to 80% of your immune system is in the gut, and it can cause it to attack your own body's healthy tissues. And there are several different tests that we can order to determine if you have these food sensitivities. And you need to be checked for this. Autoimmune diseases are more and more prevalent. Hashimoto's is the most common of the autoimmune diseases, but a person can develop an autoimmune reaction to any organ, like the pancreas in type 1 diabetes, like the joints, as I said, in rheumatoid arthritis. It can attack your nerves, as we see in multiple sclerosis. It can affect your eyes, as seen in Sjogren's syndromes. We have celiac disease, lupus. These can affect your skin, your joints, your kidney, your brains, and other organs. And about psoriasis, and I lived with it, and my psoriasis is currently under control, and it's no longer, and I can go to a swim party now. I feel really good about that. So rather than treating the symptoms, the immune system has to be checked to determine how well it is functioning and if it is balanced. Because if these two things are not balanced out, it's going to cause one side to be more dominant than the other. So, Clinically, the only thing you can do with an autoimmune disease is restore balance to the immune system and kind of downregulate or modulate the immune system as well as you can. Autoimmune diseases are genetic. Once the gene is turned on, you can't turn it off. So what we have to do is we have to balance that teeter-totter. And we have to discover what side is more active, okay? So what side is more dominant? How do you know? Okay, there's certain tests that can be run to find out which one there is. And basically, we can do a challenge test to find out which one that is too. So we have to realize that if Th1 system and the other side sends out B-cell antibodies, that's your Th2 system. So if you produce too many of these natural killer cells or these cytotoxic T cells, you're Th1 dominant. If your body produces too many B cells, then you're going to be Th2 dominant. So being dominant one side or the other is going to make your immune system out of balance, and you either already have an autoimmune disease or you're going to get one. I didn't say you're likely to get one. Sooner or later you're going to get one. It's just a matter of time. That's why this is so important that you understand this. It's common for most patients with Hashimoto's, type 1 diabetes, MS, chronic viral infections to be Th1 dominant, but it doesn't mean that it's 100%. So generally patients with lupus, dermatitis, asthma, multiple chemical sensitivities may be Th2 dominant. I have psoriasis and I'm Th2 dominant. That's not always true, however, and not all autoimmune disease can be traced to a Th1 or Th2 dominant. So you need to test and not guess, and I mentioned that in my thyroid book many times. Why guess when we have the technology to test you properly to find out exactly what's going on? Now, if it's determined that you have an autoimmune issue, then the problem is we must address the immune system, not your thyroid gland. And we must restore and bring your immune system back into balance. Any autoimmune disorder is made worse by unstable blood sugars, poor adrenal health, bad gut. Remember, up to 80% of your immune system is in the gut. That's why I literally have this ultimate thyroid health video on all these topics. Several studies have linked Hashimoto's to gluten intolerance. One study that was conducted was in Europe, concluded that gluten sensitivity is significantly increased with patients with autoimmune thyroid disorders, and all patients with autoimmune thyroid disorders should be screened for gluten sensitivity. So if you come back and you have a positive TPO, or if you have a positive TGB test, antibody test, that's an indication you have the autoimmune component, and gluten must be removed from your diet, especially if you're positive to it. Now, if you haven't been tested yet, you can take gluten out and see how you feel. If it feels better, it means that could very well be one of the triggers. In video 1, I talked about all these other triggers that can cause the immune system to ramp up and become disorganized and confused and ramp up and attack the thyroid gland. So, just remember, there's a small percentage of people who feel worse when they remove gluten from their diet. Because for some of these people, gluten can affect or respond to the opioid receptors in the brain, and this will cause withdrawal symptoms. It's like taking somebody off a drug. It's like a drug addict. Basically, those receptors are no longer getting fed, so to speak, and what happens is you kind of get the withdrawal symptoms from that. So basically, some people can be addicted to gluten, and if it makes them feel lousy. So if you feel worse after removing gluten from your diet, adding it back in is not the best thing to do. So since the T regulatory conductor regulates the immune system, the first step in health balancing is to support the T regulatory cells. And vitamin D is one of the things that help do this. So if you have any autoimmune condition, vitamin D is very, very important. So you need to be tested for your vitamin D levels, okay? So, number one, first thing I'll let you know, vitamin D can be toxic. So if you take too much and you're not retesting, guess what? You could get vitamin D toxicity. So you must have them checked. So you need to check both the storage form and the active form. The storage form is called 25-hydroxy-vitamin D. The active form is 125-hydroxy-vitamin D. Now most doctors will only check the 25-hydroxy-vitamin D. You need to insist that they check the 125-hydroxy-vitamin D also, okay? And this is important, okay? Because the T cells kind of regulate the teeter-totter effect. And it supports your immune system, and it helps calm down the immune system by balancing it out to teeter-totter. So if you want more information on vitamin D and thyroid, watch my Ultimate Thyroid Health video on vitamin A and vitamin D and the thyroid. Now the next step, once you know if you're Th1 or Th2 dominant, we have to boost up the side that's low. So if this is Th1, this is Th2, we have to boost up the side that needs to be balanced. So There are some stimulating compounds out there like astragalus, echinacea, beta-glucan, mushroom, licorice, and lemon balm that will help stimulate the Th1 side. So if Th1 is low, that'll bring it up. Now some things that actually bring up the Th2 side can include green tea, grapeseed extract, pine bark, white willow bark, lycopene, resveratrol, pycnogenol. Now remember, if you are Th2 dominant and you're drinking green tea every day, guess what? That's going to make you more dominant, and that's going to make your symptoms worse. Okay, so coffee and green tea are ramping up the immune system every time you drink it and may cause the immune system to attack the thyroid tissue. So do you see how everyone is different and everyone needs an individualized plan? With nutritional support, you can help modulate the inflammatory cells and the cytokines and help calm the immune system down. So we can reduce some of these interleukins, especially like interleukin 6, okay? So now let's talk a little bit about testing. How do we assess the immune system function? Well, first of all, we determine, number one, does the patient have an autoimmune disease? So we do a blood test for TPO and TGB antibodies. TPO is the enzyme that helps make thyroid hormones, and TGB is a protein. They're serum antibody tests to determine if you have Hashimoto's thyroiditis or not. Now keep in mind, if these tests are ever positive, you have an autoimmune component. If they are negative, it means that this time they are not showing up. But that's not conclusive forever, however, because sometimes you have to repeat that test because these antibodies can fluctuate up and down also. And so if you did a test and they're low, it's going to look like you don't have Hashimoto. If you retest and they're ever elevated, that's an indication that you do have Hashimoto's. Now it's important to remember that regardless of which dominant side you have, Th1 or Th2, okay, you still require vitamin D because vitamin D kind of regulates to calm down that and get the teeter-totter back into balance. Essential fatty acids or fish oil may help calm down the immune system. Antioxidants may support the immune system. And of course, if you have any food sensitivity, gluten, dairy, soy, you want to get rid of these food sensitivities because every time you eat these foods, they cause inflammation in your gut for up to 6 months, and that promotes further inflammation, and you end up in a vicious cycle. So you must get rid of these antigens or these foreign invaders that are provoking an autoimmune attack. Now, just as gluten provokes an attack on your thyroid gland, when you have Hashimoto's, other things such as mold, bacteria, parasites, or chronic viruses can do the same. So if you have some of these things inside your GI tract, you must test for them so we can get rid of them. Now, a person can also develop an immune response to environmental chemicals, heavy metals, and basically, a complete case history is essential along with immune tests to determine which antibodies are being produced to particular antigens. And it's tough. This is not easy. You have to be like a detective to find these things out. And that's where I come into play. So managing the active antigens means you have to support Th1 or Th2 pathway that is non-dominant, and you got to remove these things to drive these antigens into remission. And this helps restore the balance in your body. You hear people who maybe have an MS and all of a sudden they went into remission. What happened? Well, maybe things got balanced out. Maybe they started changing their diet and they took gluten or soy or eggs out and they didn't even know they were sensitive, but they started feeling better because they were eating healthier. So they kept eating that way, they felt healthier, and then maybe they slid off the wagon and they started putting these things back in, and what happened? They actually went into the back active form, and the immune system got ramped up again and started attacking healthy tissue. So, now, we got to look at your gut, your respiratory tract, your brain barriers, because these things can become permeable or leaky in the case of leaky gut. And these heavy metals can pass through these barriers. Now, if you have a heavy metal such as mercury, and that can be checked via testing. We don't test everybody for everything. It's based upon your case history. But we have to make sure that we restore the integrity to the immune barriers, okay? So that these heavy metals and these different types of bacteria and things don't slip back into our bloodstream or get into our brain and our nerve tissues. So, let's talk a little bit about leaky gut syndrome. And basically, I'm going to draw that up for you. Let me just erase this, okay? Let's talk a little bit about leaky gut syndrome. Now, what leaky gut syndrome is that you have to realize, and I tell people this, is that your GI tract is like a big tube, and basically, let me just draw these out. Okay, so we have this, let's say this is your GI tract, and then what you do is you have these little mucosal barriers, they're called. And pardon my drawings because I did flunk art. But anyways, here's what's going on. This is your gut, and you have bacteria in here, and we'll say the bacteria look like that. You have pathogens, and we'll say the pathogens look like this. And then of course we have little nutrients as it goes through our GI tract. And what happens is we have these little junctions here. And what happens is that these little junctions allow some of these things to slide through. Okay, these are your nutrients. And then what happens is they go back into our bloodstream. Okay, and what happens is the nutrients get in our bloodstream, and then our body can utilize them for biochemical reactions. Now, with leaky gut syndrome, LGS, or intestinal permeability is the big term, what happens is this. What happens is that these junctions actually become wider. Okay, and these little gates that were here, these little gates here get broken down, and pieces of those gates, they end up going into your bloodstream. And so if we do a test and we find these, they're called actin and myosin, if they're in your bloodstream, that means you have leaky gut syndrome. Now there's something called secretory IgA, which is kind of a mucosal barrier, and then if that is low, that's another indicator that this GI tract has been broken down. And what happens is that when these things get wider, then what happens is things like this, these little pathogens, bacterial, viruses, they can go down and they end up in your bloodstream. And what happens, then the immune system says, what that foreign invader doing in the bloodstream? And the immune system actually ramps up and it actually attacks and ramps up the immune system. And then what happens is that these inflammatory cytokines, they come around and they start breaking down this layer, and it becomes a vicious cycle. Okay? And when you have food sensitivities, let's say like you eat an apple, okay, and because these holes are larger, normally a large undigested protein molecule of an apple, which would basically look like this, basically the large undigested apple starts to go through these mucosal barriers. And then what happens, it gets in your immune system. The immune system says, what's that foreign invader doing in there? What's that perceived intruder doing in my bloodstream? And what happens is that your immune system will start making antibodies toward apples. And guess what? When you eat an apple, every time you eat it, the immune system thinks it's foreign, the immune system ramps up, it can start attacking your thyroid gland, and usually this isn't the case with gluten, soy, eggs, dairy, or a host of foods, and basically it creates this vicious cycle. Now, have you ever heard of somebody who basically ate foods most of their life, and what happens is that later in life they couldn't eat those foods because they developed a sensitivity or an allergy to them? Well, this is the mechanism why that occurs. See, most people aren't explaining why things happen. So we have to realize if we want to heal the gut, there are certain foods we need to take out to decrease irritation to the gut lining. And then, of course, put foods that are healthy in there to support digestion. Okay? So there's certain nutritional compounds, botanical extracts, flavonoids, antioxidants, glycoproteins, and things like that to restore the barriers in eliminating stress. So you can see, understanding these processes are very important if you want to address Hashimoto's. And if you have Hashimoto's, we must address the immune system, not the thyroid gland. So friends, if you have any questions, please email me at drkunger@feoohio.com. Or you can go to my website if you're not already there, www.balancingyourchemistry.com. Watch all my videos. Watch the thyroid lectures. It's a great overview how the thyroid works. Start out with video number 1. And remember, you can get my book, Your Thyroid Chemistry Doesn't Lie. It's available on the website. I'm Dr. Keith Unger, and I'd like to thank you for watching. I wish you all the best in health.